The grim reality of car park care, a crisis in England's emergency departments. A chilling picture of England's struggling National Health Service, NHS, has emerged from a recent Unison survey, revealing a devastating consequence of overflowing emergency departments. Patients are dying in ambulances while paramedics desperately wait for hospital admission. This isn't a distant, hypothetical scenario. It's the harsh reality faced by ambulance crews across the country. The survey, encompassing nearly 600 ambulance workers, paints a grim portrait of a system buckling under immense pressure. The sheer volume of patients requiring urgent care has resulted in unprecedented delays, forcing paramedics to provide life-sustaining treatment in the back of ambulances, often parked in hospital car parks, a grim practice now chillingly termed car park care. This isn't merely inconvenient, it's a matter of life and death. Paramedics are witnessing patients succumb to their illnesses or injuries while trapped in a system designed to save them. The emotional toll on these dedicated professionals is immeasurable, adding another layer of tragedy to this unfolding crisis. The official target for ambulance handover times to emergency departments is a mere 15 minutes, with an absolute maximum of 30 minutes. This seemingly reasonable timeframe is routinely shattered, highlighting the systemic failure plaguing the NHS. A Guardian investigation, published in January 2025, revealed the shocking scale of the problem. Ambulances languished outside A&Es for over 1.5 million hours in the year leading up to November 2024, a staggering 62,500 days lost to needless delays. This translates into countless hours where vital medical intervention could have been administered in a proper hospital setting, potentially saving lives. Imagine the scene: a paramedic, highly trained and equipped, battling to keep a critically ill patient alive, not in a sterile hospital environment, but in the confines of a cramped ambulance, surrounded by the sounds and stresses of a chaotic car park. This is the brutal reality for countless NHS workers, forced to make impossible decisions under unimaginable pressure. The lack of timely access to hospital beds translates to a tragic loss of life, a situation exacerbated by the sheer volume of patients flooding emergency departments. The consequences extend far beyond the immediate victims. The constant stress and emotional burden on ambulance crews lead to burnout and potential staffing shortages, further crippling the already strained system. This vicious cycle of delays, inadequate resources, and overworked staff contributes to a crisis that demands immediate, decisive action. The emotional toll on paramedics, witnessing preventable deaths due to system failures, is immense, contributing to a crisis within a crisis. The Unison survey acts as a stark warning. The current pressure on the NHS is unsustainable. The system is failing, not due to a lack of effort from dedicated healthcare professionals, but due to a fundamental lack of resources, planning, and systemic reform. This isn't simply about long waiting times, it's about preventable deaths, overworked staff, and a healthcare system teetering on the brink of collapse. The Department of Health and Social Care acknowledged the severity of the problem, stating that long ambulance handover delays are completely unacceptable. They highlighted their commitment to reforming the health service through a plan for change, implying an acknowledgement of the inherited problems and a commitment to address the issues. However, the scale of the crisis demands far more than just words. It necessitates immediate, tangible action to alleviate the pressures on emergency departments and ensure that patients receive the timely, life-saving care they deserve. The ongoing car park care crisis isn't merely a symptom of a broken system. It's a stark indictment of the urgent need for comprehensive reform before more lives are tragically lost. The silence on tangible solutions is deafening. The time for action is now, not tomorrow. Lives depend on it,